Elite TLSO provides superior motion restriction and stability of the thoracic lumbar sacral spine. In addition to fitting instructions for the brace, this video also outlines at-home care instructions. Clinicians can find the correct size of the Elite TLSO by measuring the patient around the waist and hips. The adjustable back panel in the Elite TLSO can accommodate a variety of patient anatomies. A clinician must measure the distance between the patient's C7 to S1 to determine the height of the posterior strut. Begin by removing the posterior strut from the posterior sleeve. Pull the hook and loop material apart. Then remove the strut from the sleeve by removing the hook and loop locking tab. Adjust the posterior strut to the desired height by depressing the locking clip and sliding the upper part of the strut downward to disengage. Once the desired height is determined, align the 4 posts and slide the upper part of the strut upward to reassemble. Make sure the 4 posts are engaged and the automatic locking clip snaps back into place. Finally, confirm the posterior strut height is correct and covers C7 to S1. After the clinician has finished the adjustments, they can reassemble the brace by reinserting the posterior strut to the posterior sleeve. Please note that the posterior strut height must be set prior to bending and/or forming. Next, ensure the back panel is centered and low on the back. Begin by applying the shoulder straps first. Then wrap the belt around the torso. Then place the pull tabs on the belt about 2 inches or 5 centimeters behind the patient's lateral midline. And pull the ends of the belt away from each other, ensuring the belt is fully extended. Apply the brace tightly around the abdomen, with the right side overlapping the left. Please note that when applied properly, both the upper and lower edges of the brace should be snug. If there is any gap, reapply the brace and angle the ends to ensure a snug fit at both the upper and lower edges. For certain patients, the ends will need to be steeply angled. Slip each thumb into the pull tabs. Extend the tabs out and away from the brace. When desired compression is achieved, place the hook side of the pull tabs down onto the loop material to secure. To adjust the shoulder straps, remove the hook and loop tab on the shoulder strap. Then tighten both left and right shoulder straps until properly fit. If needed, the excess shoulder strap material can be trimmed. Then reapply the tab. If the underarm placement is uncomfortable for the patient, the posterior connection points can be adjusted up or down and in and out. After this initial fitting, have the patient sit, then stand, and readjust fitting as necessary. The brace should stay in position and remain fixed with patient movement. Clinicians should always determine proper adjustments and wear time. Remove the brace by first removing the pull tabs and placing them towards the back. Next, open the belt and let the sides hang loosely. Finally, lift on the shoulder straps to allow for additional slack for easy removal and application. To reapply the Elite TLSO, simply place arms in shoulder straps. Gently pull the sides of the belt out to automatically snug up the shoulder straps and reapply. To clean the Elite TLSO pads, wipe with a damp cloth and mild soap. Wipe off excess with clean water. Allow to fully air dry. For more information regarding the Elite TLSO, please visit aspenmp.com.